Welcome to Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. Summer is here and the virus is showing no sign of abating. Accordingly, Seoul has decided to postpone the opening of its outdoor swimming pools and water parks at the Hangang Park. We start the program now with the headlines for this Friday with our Kwon So-ah and Noarang. Welcome.
Hi, Sunny.
So it's been a bit of a roller coaster ride for Korea this week. How are we wrapping up this Friday?
Yes, we had quite some fluctuations throughout the week. Maybe from other nations' point of view, it doesn't seem like some insignificant fluctuations. But here in Korea, a number above 50 and below 50 really does matter. And it looks like today we're slightly below 50 as we have 49 new cases. And that brings the total to 12,306. The death toll remains at 280. And we have 1,191 people still in quarantine or being treated. And 10,835 people have made a full recovery. Now, let's take a look at how the past 7 days looked. Last Friday, we had 56 cases. So this Friday, that's a slight rise compared to last Friday. But we did see a decline to the 30s even, but then again, a surge to 59 on Thursday. So today we have 10 less cases than yesterday. And for the past 2 weeks, the average was 43.4 patients. Now, according to this morning's regular government briefing, most of the new cases, 32, were local transmissions linked to cluster infections. And recently, the trend has been shifting from clusters at large facilities that are vulnerable to the virus to group infections at smaller gatherings. And also, the number of imported cases is on the rise, as 17 of those have been reported this Friday, with 11 of those detected at the airport's screening procedures. And this is attributed to an increase in foreign laborers entering Korea, whereas earlier in the year it was more Korean nationals that returned to the country in concern of the COVID-19 situation abroad. And a newly arising concern is the sudden increase in infections outside the metropolitan region. The city of Daejeon reported 6 new cases. Authorities vowed to swiftly conduct contact tracing of any potential cases in that region. And the government, meanwhile, also called on stronger inspections on the abidance of quarantine measures at facilities for elderly people, as the number of patients in that age group is inclining as well.
Right, so correct me if I'm wrong, but I feel like the virus has been spreading at a faster speed this first month of summer.
You're not wrong. In fact, health officials compared the number of cases from June 1st to the 17th and to the entire month of May, which turned out to be 754 and 729 respectively. So we do have already more cases in June than the entire month of May. So despite people's anticipation of being less affected from COVID-19 in summer, there are now worries a secondary wave is possible in this hottest season of the year, with many experts believing temperatures do not play a big factor for the highly contagious novel coronavirus. That's why a secondary wave may come earlier than autumn, which was an earlier widespread belief.
Right, so what are we looking at on the international front on this Friday?
Well, as of on Thursday, we had 140,000 additional cases and over 5,100 deaths in a day across the world. And that brings the total to more than 8.57 million. And also the death toll stands at more than 456,000. And just comparing the figure to Monday, we had more than 7.9 million. So now we're far above 8 million. And taking a closer look at some of the majorly affected regions, the U.S. has a death toll of over 120,000 now, and Brazil over 47,000, and Russia has a much lower death rate but has more than 561,000 cases, and the UK has now surpassed 300,000 cases. Moving over to other regions, we have a significant change here in Chile. We talked about this yesterday. Chile had added tens of thousands of new cases that were omitted earlier. That's why Chile is now right behind Italy with more than 225,000 cases.
So let's get more details about the US, Brazil and Russia, which account for roughly half of the world's cases.
Right. If we combine the total number of these three infections of these three countries, that is, it comes to almost 3.9 million. So let's wrap up the week by taking a look at the most affected places in the world. After the US was seeing a slowdown in the spread and lifted stay-at-home orders, now some 10 states are actually registering their highest 7-day average, mainly in the Southwest. Arizona, Florida, Nevada, Texas, California among those. And Los Angeles County accounts for almost half of California's cases. And Brazil, with the world's second highest number of infections and deaths, has been reporting more than 1,200 fatalities for 3 straight days. As the country is nearing 1 million cases, a U.S. Health Research Center projects Brazil's death toll to surpass that of the U.S. in a month. And meanwhile, in Russia, a country that's had significantly lower figures of deaths, this country is struggling over a lack of protective equipment for medical staff, as almost 500 health workers reportedly died while treating COVID-19 patients.
All right, so thank you for that. Stay with us for more of the domestic updates after the regular briefing.
All right.
Aram, with COVID-19 cases rebounding worldwide, growing calls for a vaccine, and they want it fast.
That's right. The WHO hopes there will be a vaccine by the end of next year that would be reserved for what they're calling the priority populations. This was the WHO's chief scientist speaking on Thursday.
We're hoping that in 2021 that we will have 2 billion doses of 1 or 2 or 3 effective vaccines to be distributed around the world. There's a big if there, because we don't yet have any vaccine that's proven.
She also said that she is encouraged by the number of possible vaccines currently being tested and hope at least 1 or 2 would prove ready for use by next year. She added that for this year, the WHO is optimistically hoping for a couple of 100 million doses. The WHO is drawing up plans to help decide who should get the first doses once a vaccine is approved. This will be prioritised for medical staff and people on the front lines. Around 10 potential vaccines are now undergoing human trials in the hopes that one can become available in the coming months, in fact.
Right. Meanwhile, Aram, more Koreans overseas are returning home, I hear.
That's right. This time, more Koreans living in Kenya are being repatriated. It comes as cases are surging in East Africa, so concerns are definitely heightened over there. A Qatar Airlines flight carrying 52 Koreans left Nairobi on Thursday, local time. It stopped in Doha, and the Koreans transferred to another flight bound for Incheon Airport, which is expected to arrive in the coming hours, in fact. That flight from Kenya also had people from 37 different countries. Now, the Korean embassy in Nairobi worked out the schedule with local officials in order to have the passengers from those many countries get on one flight. Korean civic groups, meanwhile, have sent $380,000 worth of medical supplies to the Kenyan government to help the country's fight against the virus.
Right, and I understand you have some good news for air passengers who were not able to use their air miles.
That's right, some good news indeed. Korean Air and Asiana Airlines have decided to extend the expiration of frequent flyer miles by 1 year after the government urged them to do so. Now, the move actually comes after criticism that the expiration is unfair, as the use of mileage points has become impossible due to the pandemic, of course, with these travel restrictions. As a result, passengers will be able to use mileage points set to expire this year until next year. The airlines have suspended more than 90% of their flights, meanwhile, on international routes since March amid the global travel restrictions and cancellations.
All right, Aram, thank you for that. Have a safe weekend. We'll see you on Monday.
You too.
Up next, we turn to the regular government briefing on COVID-19. The metropolitan region now accounts for more than 20% of the nationwide number of infections. What's more, health officials believe that domestic travel during the summer holiday will lead to new spikes in cases, as the warmer weather is unlikely to prevent the spread of the virus. Accordingly, authorities are framing guidelines for safety at beaches and water parks. They're also claiming that mass gatherings, even outdoors, hold the risk of contagion, especially in the absence of face masks. Yet another disturbing finding is that dining at restaurants has led to a series of recent infections as well. Thus, officials are calling for a healthy distance while dining and to refrain from sharing dishes and talking. They also add that physical distancing is the only way to keep the virus within manageable capacity until a vaccine or cure is developed. Also, the number of government-rationed masks that one can purchase has been raised to 10 per week as opposed to 3. So for those of you who've already purchased 3 this week, you can buy 7 more. So far here in Korea, there have been more than 12,000 cases of COVID-19, as mentioned by our Konsoa, and 280 have lost their lives. We are still waiting for that briefing to commence, and perhaps while we are waiting, we can take a look at the numbers for this Friday here in Korea. We have 49 new cases on this Friday, a drop from yesterday's 59 cases. Our total stands at 12,306 now. We will come back to you after the regular briefing.
시작하겠습니다.
Well, it appears that the official is yet to approach the podium, so while we wait for him to do so, or for Chung Eun-kyung, the head of the KCDC, to approach the podium, we will give you the figures for this Friday again. We have 49 cases, raising our total to 12,306. We have no loss of life today, so our death toll stays unchanged at 280. Those in quarantine, we have 14 more people in quarantine, raising our total that to 1,191. And 35 people have fully recovered on this Friday, raising our total number of fully recovered patients to 10,835. We'll come back to you afterwards.
First, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of June 19th, today, we have 32 local transmissions and 17 imported cases, and we have a total of 49 new cases today. And now the total number of confirmed cases stands at 12,306. 35 more people have fully recovered, and about 88% have fully recovered, and a total of 1,191 people still remain in quarantine. Let us now look at the major updates on the domestic infections. In the Richway in Gwanak-gu District, Seoul City, we have confirmed that 7 additional cases have been confirmed, and they were under quarantine, and a total of 187 have been confirmed to date. And related to Seongsim Daycare Center in Dobong-gu District, Seoul City, we also have 2 additional cases being confirmed under contact management. In total, 40 cases have been confirmed to date. And in Gyeonggi-do Province, Uwang City, we have the Lotte Logistics Center. We have been carrying out the epidemiological investigation there, and there were 4 more confirmed cases. And we are conducting contact management there. And in Daejeon, the Dreaming Church in Galmadong, Seogu District, we have confirmed that out of the 15 people, 9 were also recategorized as a new cluster infection related to Seoul's business establishment. And in Daejeon, we have a door-to-door sales in Gwajeongdong, Seogu District, and we have 23 confirmed cases to date. And today we have 17 imported cases from overseas. 2 were from America, 1 from Africa. And aside from China, we have Bangladesh, Pakistan, and India. Us at the KCDC, we would like to strengthen our quarantine measures, and we are also cooperating with the 11 medical facilities nationwide to designate them as the specified infectious disease control hospitals. And they have been 2 of these new hospitals have been newly administered and established so that we can look at the infectious disease cases there in the specific districts and provinces. They will also carry out on-site training for the experts for the infectious disease control measures, and we will also carry out the recategorizing of the patients according to their severity of symptoms. And KCDC stresses that we need to protect the health conditions of the elderly citizens, especially the pneumonia symptoms. And currently we had the vaccines for the elderly pneumonia symptoms, and this was only done at the public health centers. However, they will be expanded now to all hospitals. So starting from a Monday, which is the 20th of June, you will be able to have these vaccines at regular hospitals as well. So when you visit the clinics, please wear your face mask and disinfect your hands on a regular basis. And as for the hospitals, please separate the vaccine area from the regular diagnosis room so that you have no mix of the confirmed cases or anyone who have been infected. And KCDC would also like to highlight that we have seen venues like restaurants and other gatherings that are actually have high risk of infection. And we also carried out analysis, and four restaurants had cluster infections, while 6 bars also lately had cluster infections. And we also saw that there were chains of transmissions to acquaintances and workers as well. And we also conduct the epidemiological investigation for the Tail High School in Icheon, and we have confirmed that this teacher who has been confirmed at this school have been come into contact with another cluster infection at a same bar in Gangnam-gu district in Seoul. And these 2 tables sat close to each other, and out of the 7 people dining on that table, 6 people have been confirmed to have tested positive for the virus. So we would like to highlight that in enclosed spaces with poor ventilation, if people sit close together and if they don't wear face masks, and when they eat together and when they engage in dialogues, which increases the travel of respiratory droplets, there is a higher rate of infection. So we ask you to refrain from these gatherings, and please comply with the quarantine measures on a regular basis. The KCDC also highlights that through various channels, including religious small group meetings, club meetings, and door-to-door sales, there have been a great transmissions of the COVID-19. So we have expressed concerns that a massive nationwide wave could occur. And as for places of worship and religious facilities, please refrain from meeting together in small groups and engaging in respiratory droplet producing activities such as singing, eating, and tea time. Also, when you have to have offline services, please reduce the number of participants, and please keep the participants to have certain distance among each other, and please wear face masks and wash your hands and disinfect them on a regular basis. And please avoid from activities such as eating and singing, as these can increase the travel of respiratory droplets. Lately, we are seeing an increase of the portion in the elderly patients, and therefore this is leading to the increase of the proportion of patients with chronic and severe symptoms. And please understand that you should be refraining from any confined, crowded, and closed-door environment and engaging in activities like eating and sitting that increase the possibility of droplet infection. And we also ask the members of the public to always remember that COVID-19 outbreak can occur in any confined, crowded, and close contact environment. So gatherings such as social club meetings and religious small group meetings should be postponed. And nightlife establishments, bars, karaoke should also be avoided. In daily life, hand washing, mask wearing, and 2-meter distance should also be practiced. As we near the weekend tomorrow, we have been seeing a cluster outbreak in not only in the metropolitan area but also in Daejeon and Jeonju cities, and we are having an enlarged scope of the virus. And we also continue to see sporadic outbreaks with infections whose traces are unidentified. This means that there are silent spreaders of the community, and actually there could be a lot of them in the community. And during the weekend, we advise you to reduce the physical contact through gatherings and outings, because this could increase the exposure to the virus and would also lead to chains of transmissions. So we ask you to refrain from going outside or gathering in small groups and large groups during the weekend. And first of all, we would like to highlight that you need to check whether these facilities that you are about to go are ventilated, because underground or otherwise enclosed and poorly ventilated spaces are prone to infection. And please check the number of participants. So because you need to have at least 1 to 2 meters of distance with each other, and you should not go to facilities where it's crowded and where you cannot keep these physical distance. And third, you need to check whether people are wearing face masks, because you will be exposed to the virus if you engage in droplet-inducing activities like singing and chanting or sporting activities. So please do stay home during the weekend and spend quality time with your family members. Of course, it may be inconvenient. However, please remember to wear your face masks when you go to offline services as well. So please keep healthy during the weekend as well. Thank you very much.
Right, that was Chung Young, the head of KCDC, with Friday's afternoon briefing. Swa, to give us a summary of the key announcements.
Sure. Well, it looks like there are 3 major concerns right now here in Korea when it comes to the coronavirus. First off, the rise of imported cases that we had today, as there have been 17 new cases, and those came from a variety of countries like the Americas, Africa, Pakistan, India, and also Bangladesh. And Bangladesh is actually the country that surpassed 100,000 cases just on Thursday. So that is one of the concerns. And another is the cluster infections that not only happened in the Seoul metropolitan area, but also in Daejeon, where we had a case related to a door-to-door business, which had 6 additional cases, raising the total to 24 in that case. And the Richway door-to-door business in Seoul also has 7 more cases, bringing the total to 187. And the third concern is elderly people with the virus, as in the past 2 weeks, the number of patients above the age of 50 accounted for 55%. And that's also why Tong mentioned that those can get pneumonia vaccines beginning on June 22nd on Monday, not only at community health centers, but also at other private hospitals and medical facilities. But if they do go there, they should wear their masks, and that goes for everyone over the weekend.
Right, Swa, thank you for that. Have a safe weekend. We'll see you on Monday.
You too, thanks.
Services, the public health services are not that strong. It's very important that refugees have access to these places.
June 20th, that is tomorrow, marks World Refugee Day, and this year we celebrate its 20th anniversary in the midst of a pandemic that appears to be aggravating the plight of refugees worldwide. For more on this unfortunate situation, I have James Lynch, the representative of the United Nations High Commissioner for Refugees here in Korea. Welcome to the program, Mr. Lynch.
Thank you very much for having me.
do you tell us a bit about the background leading up to the designation of this particular day and what it means?
June 20th was picked in 2001 by the General Assembly as World Refugee Day. It was to highlight the plight of refugees, but also commemorate the resilience, the contribution refugees make. Sadly, this year, from last year, we've gone up 9 million refugees and reached almost a total of 80 million forcibly displaced persons, including of that 25 million refugees.
Oh, that is quite a high number, Mr. Lynch. How is COVID-19 also affecting the plight of refugees worldwide?
Well, the four words to come to mind is it's been a miracle on an edge. We have been fortunate enough not to have any major outbreak in any refugee camps, but we're also dealing with the situation where we have large concentrations of people. We have issues about hygiene, sanitation, social distancing, the proper masks and this kind of equipment being available. So we feel that we're still very much at a high risk of an outbreak.
Mr. Lynch, in an interview with the local press, you described Korea and its people's response to the refugee matters as mature. Could you elaborate, please?
Well, I think we expect this from a country which is the 11th strongest economy in the world to have a functioning asylum system. I'm on my 11th country now since I joined UNHCR, and not all the countries I have worked in, as a matter of fact, very few of them have signed the Refugee Convention, its protocol, and have introduced domestic legislation and have a functioning asylum system. As it relates to COVID-19, a lot of countries have used COVID-19 way of closing their borders and not allowing people who are being persecuted to seek asylum. Korea has kept its borders open, but at the same time been very protective of the health of their citizens and also on security grounds. So they've been able to have a very good blend of not closing the border, but at the same time addressing the concerns of health and security.
Are there any other further expectations that you have for the Korean public with regard to matters on refugees?
Well, I think the Korean government has shown great support and generosity to UNHCR. Seeing this as a global matter, they have not chosen to be isolationists about this, but they have realized that refugee issues affect everyone in the world. And so they have generously donated to UNHCR. One of the things that surprised me when I took up my post almost a year ago is the individual giving. Korea is the second largest in the world of individual giving. And at first, when I saw the numbers, I thought of large corporations giving to UNHCR, but this is individuals giving small amounts that have risen to almost $45 million to UNHCR by Korean individuals.
Right, Mr. Lynch, thank you for your kind words and thank you for sharing your thoughts with us today.
Thank you very much for having me.
올해는 그 전면 취소라는 저희 예술의 전당 개관 이래 사상 초유의 상황을 저희가 직면하고 있습니다.
언제 대면할 수 있을지는 모르지만 최대한으로 저희가 할 수 있는 모든 것들을 다 열심히 하겠습니다.
이분들 이제 눈으로 빨리 보고 싶어요. 사랑합니다.
Cultural institutions and events have been shutting doors and cancelling shows because of COVID-19. And while some are concerned about the health of the globe's arts scene, others believe the pandemic is fueling creative changes in the industry. For more on this, I have Professor Park Chun-ho from Hanyang University. Welcome to the program, Professor Park.
Thank you for having me.
And I also have Jakob Dorov, a consultant for the music industry. Welcome to the show, Jakob.
Thank you very much.
My first question, Professor Park, will take this very short. Within the cultural industry, which sector do you believe has been hardest hit by the pandemic?
Everyone is hit hard, so there's no exception at all. However, the hardest hit may be the performing art area, the traditional channel is like a theater, which is closed and crowded. And furthermore, they do not have enough resources to absorb the shocks from the COVID-19. So they are in serious trouble.
Jakob, what do you think?
I would have to agree with Professor Park. Music, of course, has been hit really hard as well, but there are lots of online revenue streams available to music, and we're seeing that concerts can move online successfully as well. But theater is all about that in-person experience, so it's a little tricky.
Professor Park, let's take this in steps then. Given the closure of movie theaters, we have a lot of these movies that have decided to postpone their release dates. How has the pandemic affected the film industry?
Well, production side, now no one allows the production to use the spaces, the hospitals, the hotel lobbies, so they are heavily depending on the studios. And then, so to speak, the digital transformation is happening quickly. So in the past, we used the chroma key screen to do the CG, but now we are introducing the new technologies such as like a LED-based screen. And the cost has went down quite a bit, and then combined with the a space, shooting space is hard to get. So we are making fast transformation to the next stages.
Professor Park, how about the television shows? How are they being affected by the pandemic?
Oh, yeah, like varieties. Again, difficult to find the shooting locations. So within the limited spaces, it is really hard to create the dramatic moments, and also people start thinking, oh, things are quite repetitive, and then it's quite hard to induce people's interest from the viewers. So, but within the circumstances, they are just trying to do their best. However, they also have some many problems under this pandemic situation.
Jakob, as Professor Park mentioned earlier on, the performing arts sector has been the hardest hit, right? How has the pandemic affected that sector? Could we go into a bit more detail?
It's just very difficult when, for example, performing arts center like Lincoln Center in New York, they have a broad campus of different venues there, and they have to shutter all of them at once, and there's really no way to take that experience online, at least that we've seen so far, whereas early on now we've seen that there's a willingness amongst audiences with concerts and pop music and indie songwriters to take that online and even pay for it. Whereas theater, I think that might be a little bit more of a jump to get there, and other forms of performing arts, the ballet and everything like that, traditional dance, that might be a difficult transition. So they're definitely hurting hard, for sure.
And staying with performing arts, theatres in London's West End remain closed in light of COVID-19. I have Professor Ellen Reid from King's College London live on the line with more information about the impact of the pandemic on the arts scene in the UK. Hello, Professor.
Hello, and thank you for having me.
Thank you for being here. Professor, I hear that theatres are extending their closures. What is the situation like in performing arts sector there?
It's been very difficult indeed. I echo what the other speakers have been saying. We've had lockdown since March the 23rd, so 3 months now of closure, and this applies to all public venues of this type. So it's been devastating for the sector in London and across the United Kingdom. We have venues such as the Royal Albert Hall, which some of your viewers may know in Kensington, which are really at the brink, effectively, of financial collapse, as most of their income does come from ticket sales. And then, of course, across the sector, we have a very well subsidised, Arts Council subsidised sector of public venues, the Royal Court, the Arcola Theatre, the Yard Theatre in the East End of London, which are much smaller and much more fragile. So these also are really under threat.
Which is why, Professor, some arts companies, including those in Korea, are choosing to take their performances online. Is this trend also visible in the UK?
Oh yes, there's been an avalanche of online provision, and I think many audiences and new audiences are being developed through this online provision because it's by definition international. In a sense, Britain is a problem because we are quite exceptionalist. Because of Shakespeare, perhaps in our past, we consider, theatre, people describe it as world leading and so forth. I don't really ascribe to that view. I think it can be very good, but theatre in Seoul is very beautiful too. And the online provision has allowed audiences to really explore and discover new provision. Milo Rao from Ghent, Societas Raffaello Sanzio from Italy, Dead Centre from Dublin. People are watching these things now and really engaging with them, but they're not engaging, as your previous spectators have said, in a space together. So the sense of community is very much lost.
Right. Professor, like you mentioned, quite a number of people in the performing arts industry around the world, of course, have a difficult time ensuring a livelihood because it's a challenge since you don't have any work. Is there a government support plan in the UK for these people?
Yes, there has been. We had an announcement very early on of a sort of relatively, some people thought, generous subsidy. It's called furlough for those people, mainly in institutions or in businesses, up to about £2,500 a month. That doesn't necessarily particularly apply to most theatre people, because most theatre people exist at the edges and the margins of institutions, not in institutions. The Arts Council of England has done some very good work in supporting freelance artists, but again, that can only go so far, and many artists are really falling through the cracks. All those artists who we think of within London, your viewers maybe know London quite well, some of them have visited the theatre in London, the diversity of the theatre is so fragile, so precarious at this moment, and it's these artists who I think desperately need some support. And Cameron Mackintosh, we're seeing a picture there of Les Miserables, the producer of Les Miserables, Phantom of the Opera, the worldwide entrepreneur, is not going to be opening his major productions until January 2021. So this is the new date they've set on reopening the musicals in London. And you can imagine that's a very successful entrepreneur of the theatre, Cameron Mackintosh, a very unusually successful figure. Imagine what all the other artists are currently suffering in the sector, in, of course, a moment when perhaps theatre isn't so much a priority for many people with such serious things happening in the world. But so many people's mental health relates to questions of social gathering and community, and the theatre does a remarkable work in that area.
There was news that the theatres in West End would open in early August. Do you suppose that will be possible?
I think that's completely impossible for a number of reasons. One is I think we started our lockdown far too late. Possibly, this is a personal view, 2 weeks too late. If we looked at the model in Italy, in Spain, what was happening back in February, we could have seen what was going to happen in the UK if we'd been speedier. And I think this would have affected the scene very seriously. We now have a long tail of the COVID-19 virus. This is deeply problematic. And the figures you showed earlier in the programme are really relatively awful still. Nobody really has confidence to go back into a theatre space anytime soon, and your previous speakers have already referred to this. So I don't imagine people will feel confident about this. My personal view is we should take this as an opportunity to develop something this year. We should say, perhaps, let's take a break for a year. Let's support the theatre spaces themselves through government funding. They bailed out the banks in 2008. It would only take a tiny proportion of that investment now. Keep the buildings furloughed for a year, and let's get all those artists, entrepreneurs, people who make performance involved in other kinds of things for the coming year, and reopen probably sometime in the spring or summer, perhaps when a vaccine is available. I call this evacuate the building. It's an opportunity for us to think differently. And there is some incredible work happening between artists and communities that I think we could develop much more carefully in Britain at the moment. We have that infrastructure. That's what we should be doing.
All right, Professor, thank you very much for making the time to share your thoughts with us live.
No, thank you, Sani, and thank you for having me.
Right, back here in the studio, Jakob, K-pop sensation BTS held an online concert, and I understand some 750,000 fans worldwide watched it.
Yes.
Would you call this a success?
Absolutely, a record-breaking success.
Tell us a bit more about it.
From over 100 countries tuning in at once. Their label Big Hit Entertainment estimated it was around 15 of their stadium concerts combined in one shot. And Korean media is estimating it's generated at least $20 million in revenue strictly off of paid concert tickets. And then on top of that, there's also merch bundles and things like that, as well as fans noticed something new, a ton of product placement and paid advertising within the concert, including commercial breaks that starred the members of BTS, interestingly. So that could be a new model that could bring in a lot of additional revenue to make up for the losses of only being able to play one show and not a complete tour.
Right.
Right.
And Professor Park, it's not just BTS. We're also talking about groups like Super M, Super Junior. They've also held online concerts. What can be done to ensure that this digital delivery to fans can turn into a permanent and productive channel of cultural content communication?
Yeah, we have seen the possibilities, but online is not a proven model yet. So we have to just, traditional sources of income, it cannot fully replaced by the online yet. But we have to still explore the possibility. And then what you have to do is keep creating the small contents and short contents, and then just deliver them to the potential customers to retain them in between the comebacks. And what we are doing right now is just filling in with small kind of vlog. I think we have to do more than that to capture them, because they have to, the value, the contents being offered through the online, and then they should be willing to pay for them. So you have to just develop, in terms of not only the quality but also quantity of content should be increased in order to capture the online opportunity, I guess.
On a long-term basis,
On
then?
a long-term basis.
Jakob, there are concerns that the rise of online concerts, however, by major music labels could actually take opportunities away from independent artists. What are your thoughts on this?
It's possible, I would say, but you have to keep in mind K-pop and things like at that level is sort of the Cirque du Soleil of popular music or something like that. There's a ton of overhead and production value that has to go into that, whereas smaller artists are able to just hop on an online platform with a guitar or a laptop and entertain people directly with basically no overhead at all. So the revenue that they make will of course be much smaller, but they get to pocket pretty much all of it. So I don't know, there might be a way to tier it that's going to work out for everybody.
Professor Park, the government is looking into ways to assist the cultural industry, of course, given the hardship in light of the pandemic. But what sector do you believe, or which sector that is in urgent need of government support?
It's really hard to,
I'm sure it
define
is.
one sector because everyone is in need for help. But as I said, performing art industry and transforming that into, so using the online opportunity, if you can help them in that cause, that'll be, a good, very, very good. And also, there are the people, artists in need, so they should be helped in some way because, they have to get over this crisis and then continue to create some contents. And also, we are living in the very dynamic world. So not only the coronavirus pandemic, but also technological advances. We also have to make investment in cities and especially applying those technology to the contents directly. So there are, so many places that require resources. So we have to be preparing for that.
Jakob, generally speaking, what is your opinion on the need for government support in the cultural industry for these artists?
I think there is a need for support, definitely. A lot of people are struggling right now, for sure. However, I think it is worth keeping in mind with a global pandemic going on, who are really the essential workers in that, and what are the sectors of society and our infrastructure that are helping us get back to normal as soon as possible. So as long as those sectors, like the frontline workers, like doctors, nurses, COVID testing personnel, as long as they're all taken care of and the technology in that department is all squared, then I think you could use secondary and tertiary funds for things like the arts. But ultimately, we want to clamp down this virus and move on as quickly as possible. And I think that's in the artist's best long-term interest as well.
Right. Professor Park, Seoul's Culture Ministry, on a lighter note, provided some 1.8 million discount coupons, I think, for movies and performances. What are your thoughts on this measure?
The government support should be based on clear and sound principle, or you can even say philosophy. And helping the artists is need-based, but also this kind of coupon support is based on economic impacts it can bring in. And then it could be criticized in terms of timing. However, we all agree that we need to do something to boost up the economy. And then just the government should, the problem is the resources again. The movie coupon used fund, like an art and culture promotion fund. That fund is getting depleted. And then what we have to do is to secure the resources and use them efficiently in the future. So we need, again, resources is the problem.
Right. Jakob, we had Professor Alan Reid mention this earlier, but even if the pandemic subsides to a certain degree, it would be difficult to get audiences to come back to these cultural venues.
Definitely.
You'd have to make them feel confident.
Right.
What are ways to ensure that confidence?
A strong vaccine would help, or very powerful antivirals. I think that might be the long-term view, but in the meantime, we might see some interesting experiments. I saw proposals coming out of Western markets of a kind of socially distanced, pod-based concert experience. So you'd have these like individual viewing booths set up in the venue, which of course would be pretty expensive because then you'd have a large space and not many viewers. So offline physical concerts may be the exclusive purview of the rich for a little while, and then everybody else could maybe tune in online. There might be some sort of like hybrid models like that we see.
I see.
Yeah.
Professor Park, what in your opinion should be done to attract audiences back to cultural venues?
You know, people say we need to learn to live with COVID-19, and then I think that means you have to keep making decisions, like a balancing decision between the safety and the needs, like a higher needs such as social belongings, and then, you know, it may not be a matter of a couple of, you know, preventive measures. We may need to overhaul the whole industry, like just a rock concert without the shouting, without the singing along. It's not the rock concert any longer. However, how much changes do we need? We don't know yet. We don't fully understand the COVID-19 yet. And as we get to know it better, we'll find a way to cope with it better.
So only time will tell then.
I hope so.
All
Hopefully.
right, Professor Park, thank you very much for your thoughts. And Jakob, thank you for being with us today.
Thank you.
Thank you.
Right, well, that brings us to the end of this week's edition of COVID-19. Be sure to join us next Monday for more on the pandemic here and elsewhere around the world. In the meantime, be sure to abide by personal hygiene practices as well as quarantine guidelines, and to reach out to us with your thoughts and inquiries through our social media accounts or homepage, arirang.com. Have a good weekend.